got it. Okay. Start it. I already started your call.
Ready.
Okay.
Hello, Cole. It's nice to meet you.
Good
I'm
morning.
Sharon. I'm going to be helping you today. We're going to be talking a little bit about the tooth that you were having some issues with. I like your shirt. You play soccer?
I do play soccer. Yeah.
My oldest son plays for the University of Findlay. We're big Crew fans. How about you?
Yeah, us too, dude. Nice.
Yeah, we go to about 3 games a season, so it's a good time. I hope that we'll see you there.
Hopefully.
The last time that you were here, we were talking a little bit about the tooth that you were having a problem with. Is that the one that was on the upper right?
Yeah, tooth. You told me it was like tooth number 2 or 3 up here. It really bothers me.
When does it bother you?
It bothers me. Like, it only bothers me when I eat, but especially when I eat like sugary foods and like when I chew gum. So you're not really a whole lot, but around those times it really bothers me.
I'm
a lot.
sure that's frustrating. Well, Cole, we have a few options to help you. I'm glad that you're here, first of all. I don't want you to feel pressured at all. So I'm going to go through those options with you and let you know what we can do to help you to fix it.
Okay.
Of course, your first choice is always to do nothing. We can leave it go. We can wait for it to get worse. If you think that the pain has gone away and it's not gotten any worse, we can wait. Or you can choose to do resin filling, which I'll go over with you here in a few minutes.
Okay.
Or you can choose to do the porcelain, which is what Dr. Olam is recommending for you to do.
Okay.
The first thing I wanted to show you is a picture of your tooth. Did they show this to you in the room? Probably not.
No.
So you can see this crack right here along this filling, and that's where your sensitivity is coming from. So that crack and then that dark area is the decay. And every time that you chew on that, if you think about how stress fracture works, it opens a little bit and closes a little bit. So that's where your sensitivity is coming from, because when you chew down, say, on a piece of gum, that stress presses on that and opens it up. Does that make sense?
Yeah.
So eventually, if you choose to do nothing with this tooth, and that fracture keeps opening and closing, that tooth is going to fracture off. So it's going to break. Now the question is will it break in a way that we can fix it, or will it break beyond repair and we have to remove the tooth? So that's why going over your options with you is important. We think you've caught it at a really great time. The crack seems to be small. We can go in and clean that decay out, clean that crack out, and then we can put something in to replace that. So of course your first option is just to wait and see if it gets worse, okay? Your next option is just to do resin filling, which we only use white fillings in here now because people don't really want the silver ones anymore. So we'll use the resin filling. The doctor will go in, clean out the decay and the cracks, and then he'll just build up with a resin material to fill that space back in. The thing with that is it's just not very strong. When we're talking about filling a tooth here, you can see the amount of filling that you already have. That's that bright white. And by the time we take all of that out and then put in a new piece, that's going to be a majority of the tooth. So this tooth is about 80% of your chewing. I don't know if you know that, but these molars are the most important. These are the ones that we recommend that you keep for a lifetime to help you to chew. And so when we take all of that out and put in a filling, that's going to be a really big filling, and that filling we don't think will withstand a long period of time. Now, I know you're young, you know, you're just getting out of college, so you may just need to buy some time until you can kind of get yourself settled, and we understand that. And so in this case, maybe a resin is for you, and then you come back in 5 years and we do the porcelain, which Dr. Olam recommends. It's completely up to you and where you stand. The third option is a porcelain onlay. This is actually a porcelain onlay. Now don't worry, it's not been in anyone's mouth, but it's one that we've milled just so you can see it. You can feel how strong it is, and that's actually a piece of porcelain. And so what we do is we bring you in, numb you up of course, and then we're going to clean out the cracks and the decay, and then the girl is going to sit down, Peg is her name, with the computer, and she's actually going to mill your tooth for you, okay? So she's gonna mill it, and then it's gonna come out looking like this. They're gonna put some cement bond in there and hook it on, and you'll be good to go. This is expected to last you 10 to 20 years. So that's a pretty long time that we expect that to last. Are there any questions about your options?
I do have a question. So when you were talking about this, on the bottom tooth, is that a crack as well? Or is that something I don't have to worry about?
That's nothing you have to worry about. That's just the natural anatomy of the tooth.
Okay.
So we're just looking at this one tooth, and this is the one that doctor feels is causing you the issue. So if you don't have any other questions, I just wanted to show you the different prices on that. So here you can see doing nothing, of course, means nothing. Here's the cost between the resin and the porcelain, and you can see that they're pretty comparable in price. So my personal opinion is since they're so comparable and you have such great insurance, that we should just do the long-term option. That way we don't have to mess with a tooth twice, because sometimes when you mess with a tooth, when you have to repair it, it'll be a little sensitive for a while, and so we don't want to do that to a tooth any more than we absolutely have to. Again, it's whichever choice you choose. Do you know which way you're leaning here?
Yeah, I think I'm leaning towards option 3, you know, going with the doctor. I think that's the best option for me.
Okay, that's great. If you have any other questions, let me know. We'll get you back in and we'll answer any questions you have. Other than that, I'll take you up front and we'll get you scheduled with Dr. Chad. It'll take about an hour and a half, okay?
Sounds
All
good.
right, good to
Thank
see you today.